It's an amazing time in haematology. We don't just have one or two new drugs coming through, but we have 4 or 5 new classes of drugs coming through, all of which work inside the cell in completely new ways compared to chemotherapy that we've had before. I came away with a strong impression that it's going to be a very difficult 5 or 10 years trying to work out how to use the new drugs, where they sit alongside the old drugs, and trying to integrate all of this explosion of new agents we have for treatment. So there are some standouts in the pack. The histone deacetylase inhibitors, drugs like depsipeptide is very good for T-cell lymphomas. Velcade for mantle cell lymphoma looks very promising. And some of the, if you like, sons of thalidomide, which we discovered worked well in myeloma, are also effective in some of the lymphomas. So we may be looking at using some of that class of drugs called immune modulators as an alternative maintenance treatment for some sorts of lymphoma. In the past, if lymphoma was relapsing, we used to expect that each time it relapsed, we'd get a shorter period of remission with the next treatment, as if the cells were learning about the treatments and learning how to get around them and becoming resistant. It's very probable that with all of these new treatments, as we introduce something very new, we'll get just as long periods of remission each time. That's certainly my hope. And of course, the prospect of a cure for some of the incurable sorts of lymphoma, like follicular lymphoma and mantle cell lymphoma. So it is an exciting time, and it's going to be a very busy time. And again, a corollary to all I've just said is, my advice to people is, think about yourself and think about everyone who's going to be following you with lymphoma and try and get in clinical trials. The evidence is that people who go in clinical trials tend to have better outcomes, even if they get standard treatment in a clinical trial, because everything's protocolized and all the tests are done at the right time and everything's followed very closely. And of course then that may give access for some people to some of the new treatments as well.